Thanks so much, Bianca. Well, Julia, I'm so excited. We've talked a couple of times and we really just wanted to have you take this opportunity to tell us more about what you've been doing and why you've been doing it. And so I would love it if you would take just a minute to just tell us a little bit about yourself and your project.
Yeah, sure, absolutely. And thank you so much, Clare Grace and Bianca, for providing this opportunity today. And it's great to see everyone. So I'm Julia Wieczorek, and I work with the New Jersey YMCA State Alliance, as Bianca and Clare Grace mentioned, as our program coordinator of state initiatives. So we are an independent 501c3 nonprofit organization. You might be familiar with the YMCA near where you are. And we're comprised of the 30 member associations that collectively serve children and adults through advocacy, collaboration, and statewide initiatives. So I've been with the YMCA State Alliance for coming up on 3 years now. I started off there as an AmeriCorps service member, and so now I've been a full-time staff member as well. And as part of our state program implementation, especially related to community and public health, we have been contracted by the New Jersey Department of Health to provide training and technical assistance to our New Jersey SNAP-Ed implementing agencies. And New Jersey SNAP-Ed is our education arm of the Supplemental Nutrition Assistance Program, formerly known as food stamps. And it really has the aim of supporting our residents in making healthy, budget-friendly food choices and leading more active lives. So as part of the technical assistance that we've provided, we've really worked towards, whole school, whole child, whole community initiatives, out of school time programs, faithful families in our churches and religious institutions in our community. And now we also provide SNAP educators with the knowledge and tools to authentically and effectively engage with their community members, connecting people to resources and supporting improved health strategies and health outcomes overall. So one of the trainings that we're now providing since a couple years now is mental health first aid. Right now it's to adults, and we're hoping to soon be certified in instruction for youth as well.
So tell us a little bit about why you chose to focus on training in mental health first aid.
Sure, absolutely. So mental health first aid, just as a quick bit of background, is a program of the National Council for Mental Wellbeing, and it teaches participants really how to assist community members that they serve who might be experiencing a mental health or substance use related crisis. So in that training, participants really learn about risk factors and warning signs for mental health concerns, some strategies for how to help somebody who's experiencing a crisis or who is in a non-crisis situation, and really where to turn to for help. So mental health first aid really teaches about recovery and resiliency. It really emphasizes the belief that individuals who are experiencing a mental health challenge can and do get better and can use their strengths to do so as well. It's really an evidence-based program, which really attracted us to it. And studies have shown that this training reduces stigma, which is so huge and so prevalent right now, improves knowledge and increases our first aid actions towards people that are experiencing mental health and substance use challenges. And it's really proven to be effective in teaching how to recognize and also to respond to those signs and symptoms.
Thanks, Julia. So tell us a little, this feels like a huge endeavor. And so tell us a little bit about how you kind of rolled that out. What did that look like?
Great question. So, this was in talks before we hit this very pivotal turn point in, I think, March 11th, 2020, where we had hoped to kind of roll this out as an early dream, as an early program for our SNAP educators. But once we, experienced the pandemic and we started to just see and feel the impacts of COVID-19 related trauma and social isolation on the communities that our SNAP educators served and that we at the Y serve, this really kind of came to the forefront of conversations on technical assistance and training. And so as SNAP-Ed continues programs that support physical well-being, nutrition, especially fitness, right, it was equally, if not more important, to also focus on mental well-being and thinking of overall health just more holistically. So educators had been asking us at the Alliance for more tools and resources that would support them and be shareable to each of the communities that they serve across the state, especially when noticing these mental health impacts, returning after virtual programming as we've all experienced and kind of getting back and reopening and working with various age groups, especially children, and trying to figure out how to really connect individuals in crisis to proper supportive services. So we started off by connecting with our funders at the New Jersey Department of Health and what we were hearing from SNAP educators about the impacts of the pandemic. And this kind of helped us determine what training options might be most supportive. So when we proposed the mental health first aid training as an option, we really framed it as part of pandemic recovery overall, right? Underlining the kind of parallel pandemic of depression and anxiety that was especially emerging in our state in New Jersey. So then we wanted to connect with experts in that field and in that space as well, especially in the mental health space and mental health first aid training. So we reached out to partner with our branch of the Mental Health Association here in New Jersey. And this really was to ensure that, any kind of resources that we were sharing out were guided by experts and kind of had that seal of approval, because we were by no means expert in the space of mental health, especially, and I like to highlight this is not a training for mental health professionals. It's a training for, just your standard day-to-day person in the community, maybe someone who's boots on the ground, right? And so we really reached out to them and we tapped into their support to guide the training and certification process, and also provide our educators with those practical strategies and best practices, as well as kind of the standard national training content.
And so, I mean, I've done, program work and training and TA work for a long time. And I know sometimes that when you get excited of like, we're bringing in this new initiative. And sometimes it's, challenging to get that buy-in from staff who maybe feel like this is just one more thing that they now have to learn and be responsible for, or maybe there's some discomfort with this in particular of it feeling like it's something out of their scope. And so how did you get the buy-in from your staff to really get them on board and engaged with this initiative?
Yeah, absolutely. And I'll speak a little bit to those challenges soon, because as you said, they absolutely did come up. But so while we were providing this training to our educators, it was really important to think about our network of the YMCA associations and our staff here at the State Alliance. So while we were planning to provide the training to SNAP educators, our director of strategic partnerships actually reached out to our team about bringing the mental health first aid training to New Jersey WISE. So it was kind of this perfect chance to align those efforts and to offer the courses beyond just the training that we were providing. And we're big believers in walking the walk. So before we could even get the team on board, my instructor colleague, Jackie Bavaro, and myself went through that full day virtual mental health first aid training before completing our instructor certification. We really wanted to pull away those takeaways, benefits and firsthand feedback that we could then share. And we knew that would kind of help build our case as well, because when we're thinking about, changing and adapting to the needs, especially following the pandemic, that was something that came across as adding to the very full plates that, our on the ground service providers are already experiencing. So we really needed to have to sort of sell the initiative at first. And I don't want to say sell, but in a way it was really kind of pushing those benefits, and, not just within the mental health space, but the benefits that you could see on nutrition, on physical activity, allowing this training, really justifying this training for SNAP Ed, which had been, so long, so focused on healthy eating and physical activity. So there was a bit of convincing, not only to the Department of Health, but also to some of our SNAP Ed partners who were concerned that it might fall outside of their program scope or capacity, right? Or kind of blur the bounds of what supports they could provide, the understanding in their communities of what supports they could provide. So we really wanted to emphasize that, this is not, again, it's not a role of a professional, right? As a mental health first aider, and we don't diagnose, we don't provide any counseling or therapy. It really just equips you with the concrete tools and maybe answers to questions like, well, what do I do in the event of someone who's experiencing a mental health crisis? And where can somebody find help or resources to support? So above all, the program is centered on empathy, which is something that, we all practice and we all have as in our roles and in what we do every day. So just being there for somebody, listening non-judgmentally, and really knowing how to appropriately and sensitively approach someone who's experiencing a challenge.
And I love when you and I talked before too, the two things that really struck me was you talking, I think, one about how this is just another tool in your toolbox. It's not, and that it's not adding something on, but the benefit of, I mean, I love how, maybe you could speak a little bit. I love how you talked about really helping make that connection for folks about how mental health can influence healthy eating and physical activity, and how healthy eating and physical activity can influence mental health. And so this really felt like it really was something that fell in very strongly in your scope. I don't know if you want to say anything more about that.
Yeah, absolutely. It's exactly like you said, right? So it was, kind of listening to what our SNAP educators were seeing on the ground, especially with the behavioral challenges. And they were really saying, well, we need some overarching mental health resources and support. Maybe it's social emotional supports, things like that. But really kind of connecting it. We always go back to the CDC's whole child model, right? Of how important that holistic support is, where it's centered on the individual, in this case, centered on the child. And I could talk a little bit more about why we started off with adult and we'll be doing youth later. But really just kind of making sure that when you're thinking about someone's overall health and well-being, right, it's not going to just be the picture of physical well-being, right? It has to be something that's overarching. And we see those impacts between nutrition, physical activity, mental health, and vice versa.
Well, we've got just a couple more minutes, and then I want to have a chance. You provided us with some great slides that have some resources, and so I want to show those, and then we want to open it up for questions and some more kind of discussion that comes from within the group. So I would say in our last a minute or two here, anything else that you'd like to add as far as if there was a particular a challenge that or barrier that you kind of work to overcome, or if you want to just share a little bit about your next steps, what do you kind of have planned to expand on this?
Yeah, great question. So I think in terms of maybe a barrier or a challenge within the mental health first aid training itself, is kind of thinking that this is not a training that's just going to impact your professional life. It's also something that's touched each of us very personally as well. And it can be a difficult topic to bring up, even among colleagues, right? Even among people that you work with every day. And I think making sure that we were creating that space where people could be comfortable to participate in this training, reflect on their personal experiences, and also be in a very safe place where they were able to challenge by choice, right? So deciding what to participate in, how to share, if to share, and what to take away. And I think, it's really humbling for us in a way to provide this training outside of the regular technical assistance trainings that we've done before, and just being extremely sensitive to that. And it did help to have kind of the experts in the space showing us the ropes along the way from the Mental Health Association. But I do think about, it does help you get to know people on a certain level that is different from maybe the general professional day-to-day experiences that you might have. So something that we're hoping to do next, a little bit on our next steps within the next few months, my colleagues and I will be trained and certified in mental health first aid for youth. Initially, we wanted to start off with the adult training as we were looking for ways to help staff support each other before we could even provide that support, to our youngest members in the community. So at least one of our other members of our staff will be trained in adult mental health first aid as well. And our goal is to continue these trainings for SNAP educators. Most have been trained at this point in the state, which we see as a huge success, as well as our Department of Health partners who participated in this training and YMCA partners as well. Within our New Jersey YMCA public priorities, our public health priorities, mental health is, at the top of the list. So this is really kind of a nice segue into the next few years where we can start to think about program sustainability. And in our hope, it's our goal, and we're not quite there yet, to be transparent, but we want to include mental health first aid training in our grants and re-grants so that our YMCAs and community partners across the state that are really boots on the ground can also have access to this training.
Awesome. Thank you.